Here at NHS Durham-Dales, Easington and Sedgefield Clinical Commissioning Group, we want to hear your views on how we improve 7-day access services to best meet your needs. In spring 2016, we held a consultation looking at urgent care services. From patient feedback, the public chose 9 hubs which were at preferred locations across the DDES area. Patients were advised to call their GP practice for appointments during the day and call NHS 111 at all other times. Patients were offered an appointment at a hub with a clinician most appropriate for their healthcare need. This appointment was made at a hub closest to where they lived or where the most suitable clinician was based for their needs. We have reviewed these services and have found out that the hubs are extremely valued by patients but are not as well used as we thought. This underuse means many appointments are going unfilled. Staff aren't seeing and treating many patients and are concerned about losing their clinical skills. This has resulted in staff leaving the service. This means that these services are not value for money and we need to spend public funds in a better way. From the public engagement that we carried out from December 2017 until August 2018, the public told us that the extended service means that they can get appointments when they need them and they experienced a good service. Staff from the GP practices told us that there is a need for same-day pre-bookable appointments. They also said that we need to consider offering telephone appointments and enhanced mobile services, for example home visiting for those who are housebound. We have some proposals for each locality and we would like to see your views on how we could improve the services delivered. In the Durham-Dales area, we propose to having one site which would be at Bishop Auckland Hospital. This would operate on weekdays 12 noon until 8 p.m. and weekends between 10 a.m. and 2 p.m. This preferred option would provide patients with greater access to same-day appointments. It would also ensure that patients are able to easily navigate to the most appropriate service at a site which provides good transport links. For those within more rural areas, we would like to listen to your views on how best you think we could bring care closer to your home. During the week, we propose services will run between 6 p.m. and 8 p.m. at Spennymoor and Newton Aycliffe. On a weekend, we think services should be delivered between 10 a.m. and 2 p.m. at 3 sites of Spennymoor, Newton Aycliffe and Sedgefield. We think that these proposals will help people to access same-day appointments. We also think that by providing more minor services in this locality, it will help to avoid people attend A&E inappropriately. In the Easington area, we propose 2 sites at a weekend at Peterlee and Seaham between the hours of 10 a.m. and 2 p.m. On weekdays, the proposal is to operate from Peterlee between the hours of 12 noon until 8 p.m. We think that this will provide patients with greater access to 7-day services and will help people to access same-day appointments. We think that people will find it easier to navigate based on their need. All of the sites have good transport links and looking at attendances, the Peterlee site is the most used. Across Durham-Dales, Easington and Sedgefield, we would like to listen to your views on how best you think we can provide services for those more frail and housebound members of the local community. This may include an enhanced home visit service. We would also like your views on how we best deliver pre-bookable appointments. Please let us know your views on the proposals we've talked about and let us know your ideas on how we could best meet the needs of our vulnerable members of the community. There are various ways which you can get involved. We will be holding public events across the DDES area and these dates can be found on our website, in the local press or our social media sites. Please register for the public events via our website or by calling 0191 371 3222. The summary consultation document is available on our website and also at locations such as the CCG reception at Sedgefield Community Hospital, libraries and your local GP practice.